At a time of deep division in today's society, we must come together for humanity's sake. On Can We Talk 360, we strive to stimulate an authentic conversation on issues that affect all of us in an environment of tolerance. I am Eugene Pettis, attorney and community servant. Tune into our discussion to foster a greater awareness of yourself and others. Let's discover how there is strength in our differences and an abundance of possibilities when we stand together as one humanity. Welcome to Can We Talk 360. I have two interesting guests who are going to bring perspective of healthcare in general and healthcare disparities within the Muslim community. As many of you know, that we've had for the last 2 years discussions on healthcare disparities, but those discussions, many times studies don't look at the Muslim community and how it impacts them both from a cultural standpoint, from a religion standpoint, and it's unique when looking at some other demographics. So I have the pleasure of having two very experienced doctors with me, Dr. Malik, who is an endocrinologist, focusing on diabetes and metabolism issues, internal medicine, specialty areas. I also have Dr. D. I'm not going to try to give his name because it's a little tough, but it's Dr. Daghistani, who came to South Florida in 1982 and did his training at the University of Miami-Jackson Memorial Hospital, and with his fellowship in pediatric hematology and oncology at the University of Miami and Jackson Memorial. He's board certified in pediatrics and holds sub-board certifications in pediatrics and hematology. And Dr. Malik has her practice out in Western Broward and has affiliations also with the Mayo Clinic, Jacksonville. Is there anything about your practice, Dr. Malik, that you want the audience to know that I've missed?
No, I think you covered it. I think an important thing to know about me is that most of my work has been inpatient. And so you see different problems that come up in that setting. But now I've also started an outpatient practice. So now I get to follow through on some of those problems that I see in the hospital. So I think that'll bring some insight into this discussion.
You've seen it both from the inpatient role where you care for them, you send them home, and you may never touch them again.
Yeah.
And now you're following them as a part of your practice. That is a different perspective.
Yes.
Dr. D, anything about your practice that I didn't bring forth for the audience?
No, not really. I'm compared to young Dr. Malik, very veteran here in this community. And I've seen things over the years change, some for better, some for worse. But I do, as you say, pediatric hematology, oncology. It's an outpatient and inpatient practice. And we see chronic disease and acute disease like Dr. Malik does.
Okay. When we talk about healthcare disparities, as we talk about the Muslim community, I want to break it down to perceptions going all the way back to school, to your training in medical school. Did you feel that being trained in medical school gave you the foundation to understand approaching patients from multiple demographics, multiple religions, multiple cultures?
Maybe Dr. Malik will start.
Yeah, I could try. I mean, now I finished training now almost more than 10 years ago. Doesn't feel like that long ago, but it was. And at that time, I know they were trying to integrate more discussions about healthcare disparities and trying to integrate that into the curriculum. But it really depends what area I feel the school is in as far as how much depth and focus will be given to healthcare disparities within certain ethnicities or religions. I think one way that our school, my medical school, was trying to do this was by offering volunteering opportunities in perhaps less fortunate areas. So that's where you will get to see some of those disparities. And it might not be implicitly said that this is how things are different with this population, but you kind of have to make your own assessment when you go into such scenarios.
Dr. D, from your perspective.
Yeah, so I really think the medical school very ill preparing for that aspect. And I think as time goes on, they are realizing that they have to change. For instance, I can tell you, for the preparing pediatric residencies, right? When I did my residency at Jackson in 1983, we went through intensive care, we went through a lot of specialty emergency room. I choose to do a fellowship, but if I choose to go up to the clinical practice, that would be very, very marginal preparation for clinical practice with all these intensive preparation. Now, the American Academy of Pediatrics, American Board of Pediatrics, they are realizing this and they are doing the changes. So now, instead of spending the majority of your residency in inpatient setting that you're probably not going to see when you go out, they're focusing more and more on the outpatient. And when you talk about diversity, it's really the same. Medical school, maybe when you are in the first year or second year, they tell you in theory about this and that, but there is nothing in training, neither in your clinical years, nor when you go into residency. There is no focus on that. And I think has to be a focus. That's the natural progress for these things. I think it will happen. It's taking longer than what we want, but we really need to push for it.
You know, one of the impetus to even getting into the healthcare disparity area was I was seeing so many cases come across my desk. I do medical malpractice work, and I make money. You know, I've represented healthcare for 39 years of practice. Healthcare has always been a part of my practice. I was representing the hospitals for 30 plus years of my career, and I've had 20 plus years. Some of it overlapped, obviously, of doing, plaintiffs, representing individuals. And I got tired of looking at the inexcusable deaths and injuries that were solely people not listening, trusting their patients. And one that I highlight that I just found to be outrageous was a nurse of 30 years was going to her own hospital in sickle cell crises. And the doctors thought she was drug seeking. After 4 visits, they finally looked at her as a sickle cell patient in sickle cell crises. And unfortunately, she was 70% occluded and she died. How could that happen with a person who's an employee of 30 years in the Broward Health system? And I just find that to be inexcusable disregard of people. And that was really a part of the impetus to start having conversations on this. One of the things that I've noted in some healthcare work is that within the Muslim community, navigating the health system, say in the Broward and Miami-Dade, there are cultural sensitivities that may not be the same in other areas of demographics in South Florida. Tell us about that, Dr. D. You can start off.
Right, sure. So, one of the things is for females, right? A female patient who feel very uncomfortable when you have a male doctor or a female who has a hijab on her head and they need to examine her and nobody knows what it is. And sometimes because of the ignorance, they starting offending the patient. Then the patient, I've seen that they said, okay, we're not going to do anything. Then you're not telling the doctor exactly what's wrong with you. You're not expressing what the problem. They get the wrong diagnosis, you get the wrong treatment, and that causes problem. So hospitals need to be more educating their staff about that. And this is one area I'm talking about. And anytime, and you mentioned about the sickle cell, I want to go back to this because I treat sickle cell patient. Unfortunately, and maybe Dr. Malik will mention this, even in the physician community, when a sickle cell child or a teenager walk in the ER, that person is a drug addict till proven otherwise. And I spent 30, 40 years of my life trying to change that stereotyping about this patient, and I'm still going and running in roles and role. So when a Muslim come in and has a hijab, everybody is going to be nervous to deal with them. You know, there is a wall, cultural wall, there is a religious wall, and very little support from the hospital, the system, to help the doctor, to help the patient dealing with this. I'll let Dr. Malik continue on that.
Dr. Malik?
Yes, I think that that is a very important thing to bring up. As far as patients who do wear the hijab, I think I have seen in my hospital, like they'll have signs outside the door that please only female patient care technicians, only female nurses, so they respect the patient's desire. So I am seeing it. I can't say I saw that 10 years ago. I just don't know if it's because of the area that I'm in. But at least people are aware of it now. And I think one of the other cultural disparities that we might see is in the Muslim community, or in the cultures itself, the Arab culture, the Pakistani culture, Indian culture, when people get older, their primary caretakers tend to be their children. So knowing that you actually have to communicate more so with the family, with the son, the daughter, to help make decisions on what the patient wants, that the patient might just say yes to everything. Right. But at the end of the day, it's the family who's helping to make the decisions. So I think recognizing that will also help us provide better care to our patients in the Muslim community.
All good points. You all have, in the various associations you're affiliated with the hospital privileges, with the staffs, physician committees, subcommittees, etc. Is there any effort to have ongoing discussions? I don't want to use the word training, but discussions to help open the eyes of those that are not from a particular community, in this case, the Muslim community, to let them be educated beyond graduating from college, residency, etc., into the practice, to help them be more sensitive to some of these issues? Are these ongoing discussions in committee structures of hospitals?
I really don't think so, because it's not very well structured, although, as Dr. Malik said, that there are sporadic acknowledgement of the differences in the culture and the religion. And it would be nice if it will build in policy and procedure of hospital, but at least I don't think it is right now. Dr. Malik?
Yeah, I can't say firsthand, but I think these issues don't come up that frequently, that maybe they get presented to a larger committee that, hey, what do we do in such a situation? Right. But I know we have, like nowadays in the era of social media, we have other ways to communicate that information. So it may not happen at the hospital platform, but we have a group of, for example, endocrinologists that when the time of Ramadan comes, there's physicians on there who will, Ramadan is a time of fasting for a month for Muslims, from sunrise to sunset. So during that time, some endocrinologists will post on there and say, hey, I've got this Muslim patient, he's on so-and-so medications. What is the best way to navigate this? So, you know, knowing that this is something different that someone is used to handling, and being able to recognize that, hey, this is a little bit outside of my wheelhouse, I think is important, because then you can at least talk to your colleagues about what is the best next step. Otherwise, maybe before you just try to do the best you can without completely understanding what fasting is, how much you're eating in the morning, how much you're eating in the evening, all that plays a very important part in what I do as a diabetologist, right, and endocrinologist. Yeah.
And even during Ramadan, what type of medications they can take.
Yeah, and what time of day, all those things have to change. Yeah.
And that's interesting. You raised, Dr. Malik, the social media. it's difficult, I guess, for any one person unless he or she spent a lot of time studying the multiple cultures we have in the United States and South Florida in general. It's a lot. It's truly a melting pot down here. Social media
Hmm.
could play a vital role
Hmm.
communicating amongst your colleagues who may be more familiar with that. Um, One of the things, I think in the African American community, I grew up here in 1960. I was born. It was segregated, and everybody, you couldn't go to Broward General Hospital. Blacks had Providence. I was born in a hospital that's been knocked down. Fortunately, we got past that probably in the late 60s, 70s. And now, from my perspective, I see people going to doctors from all sorts. I mean, from doctors who are Muslim, doctors who are white, doctors who are Black, from my community, my broad community. Do you see that within the Muslim community, or is it due to their feeling that people don't understand our culture, people don't understand our religion? They're gravitating more toward people within their community, to doctors within their community.
Usually I get phone calls. I've been in this community for 40 years, and I get a lot of phone calls from our community. Can you recommend a Muslim physician or an Arabic physician? So yes, they prefer to go for that for cultural and language reasons sometimes, especially for the elderly, as Dr. Malik mentioned in our community. But there are not enough Muslim and Arab physicians in this community in all aspects. So half of the time I say no, and I can recommend something for them. And this is take me in a segue of our religious center. For instance, we have in Dade County, Miami Garden Islamic Center, and they do have a couple of clinic that they have in Miami Garden area that is a free clinic that is open to the community, and they educate people that we're there, we're available. So it's not only the hospital and the system. I think the community need to play more and more role. I don't know, Dr. Malik will talk about the Broward, but this is something that we have to take the bull by the horn and try to improve our community health. Dr. Malik.
Yeah, I think it's a problem, not even just within the Muslim community, but within different cultures, ethnicities. Like one thing that was brought to light to me in residency was I was trying to interpret using an interpreter. One of my residents who was a Creole speaking. So he's interpreting for me, I'm asking all these detailed questions about when a problem started, how it started, this, that. And he looks at me and he's like, Dr. Malik, the patient won't know this. And then it hit me at that point that there's a degree of medical illiteracy within certain populations that if you don't acknowledge, you won't get the answer you're looking for. We're taught to dig deeper, but you're not going to get those answers all the time. And then you just have to do with the best that you have. So I think within the Muslim community as well, there is a degree of medical literacy. Like, oh, my leg is hurting. It doesn't mean anything. My arm is hurting. It doesn't mean anything. Let me just do this remedy, do that remedy. Or the idea of, something I see a lot is natural remedies are much better than medicines. There's this idea that medicine is bad within the Muslim community, or in different cultures. It's not even just this. So I think it's about education in the first place, that it's not bad to see a doctor. It's not bad to be on medicine. It's okay to be on medicine. And it's okay when you see your doctor to tell them that you're not taking a medicine, because I think there's this idea of when you see a doctor in the Muslim community or in Pakistani Indian culture, because I'm of that background, I can speak more to it, that you just have to say yes to everything your doctor says. You can't tell them that, hey, I'm not agreeing with this medicine. I'm having a side effect. I need to tell someone about it. You just pretend like you're still taking the medicine, and then the doctors try to figure out, why is the blood pressure still high? Why is the blood sugar still high? So I I think one of the things as I have residents rotate with me is I try to teach them the art of communication, discussing, asking questions, because if you ask things a different way, you will get a different answer. And we always used to laugh in residency that in training, you go in as a resident, as an intern, you ask questions to your patient, you get your answers. You're like, okay, I'm ready to talk to my attending physician. You go present the case. The attending goes in, asks the exact same questions, gets completely different answers, and you think you walked into the wrong room. Okay, so I think it just comes down to, and I think that's something I can say in my training. We learned how to ask questions and motivational interviewing skills. There was a focus on that. And I could say that, more than 10 years ago. So now I would like to think that they've continued that focus on interviewing skills for patients and trying to recognize that the different responses you might get across different cultures.
You touched upon an interesting topic. One of the, demographics that I have spoken many times to are the older African Americans. They're older. They too believe whatever the doctor says, whatever, the doctor says. And typically we don't have enough Black doctors, African American doctors down here. The white doctor, whatever he says, I'm not going to ask any questions. I'm just going to do it. And when it gets to me, it's like, why didn't you ask? And they don't believe they have. It's cultural. It's, they don't feel they know enough. They don't feel they have enough knowledge of medicine and don't want to be seen as being ignorant. So they keep it to themselves. And one of the things that I've been advocating is with all the technology we have, everybody has an iPhone. You walk at the airport or any public place, everybody has a phone. Do some work, do some research before you go in and stop the doctors to get an understanding. If you didn't understand what he or she said, stop them. And that's a clash of corporate medicine versus, a lot of these corporate doctors are, you got to see so many patients, at such a time. It's not like the old days where some of these doctors where you have time to talk. But even if you're having somebody who's trying to move you along, don't leave the office until you understand what's going on. And that doesn't happen enough. I literally hear them and they can't articulate what that experience had just been in the hospital, in the doctor's office. They don't know. I just had a gentleman here yesterday, Haitian. He lost his wife. And he's obviously a very sharp gentleman from my first occasion. They both worked at Walmart, but it's a foreign space for them to come into the healthcare. And given how diverse this country is, and hopefully will forever be, we need to really hone in on changing that culture of being intimidated in the healthcare space if we're going to get the best results, because you all are not mind readers. And if they're not open and comfortable, there's a chance something's going to be missed. Something's going to be missed. How do we balance, I know within the Muslim community from some readings, balancing faith with medicine? In other words, I think in my experience, I mean, I'm a man of faith and believe that, you pray and ask God to get you through it, but then I'm more trusting in medicine as well. Is there a difference within the Muslim community where faith sometimes trumps the medical interventions that are being offered?
Yeah, absolutely, like any other religion, and depend on where you are on the spectrum for the faith. Are you very observer versus mild? But I think definitely this is on the shoulder of the physician to understand where the patient is coming from. And we deal with oncology, we deal with dying children, and I always tell the patient, for the family, whatever religion is, yes, I'm a man of faith. I believe in God, but I also believe that God gave me the tools to help you and help your child. So take advantage of me, basically. So I think you have to make sure that you come from that angle so they understand that you're doing this for their benefit, and they understand where you're coming from.
And that's building a relationship with the patient and having just an honest communication with them.
Absolutely.
Mhm.
Yeah, I had a cancer scare in 2020, and it was stage 4 when I was diagnosed, and pretty bad. But the medicines that Sylvester, my doctor, Dr. Losos at Sylvester, put together, hitting it from multiple different directions, my cancer responded to it. And I remember when he told me that I was like 3 months after treatment started, it went into remission, and it just caught him by surprise and caught me by surprise. And I said, "Thank God." And he says, "You need to thank the medicine." So it's really a combination of the two. Uh, uh, he was more leaning, and we've never talked religion, but he clearly was more, he's a scientist and very scientific type mind. I took it as it's a combination of both. I couldn't have gotten there with just sitting in my house praying. I needed to get out and get some care, and take advantage of the science we have today versus in yesteryears. What are the things from you all's experience that you think can be done to strengthen knowledge of the cultural uniqueness of the Muslim community and their uniqueness in other communities? I'm not just isolating Muslims, but I'm talking about the communities that you all are heavily aware of. What is it that we need to do in order to continue to educate healthcare providers to appreciate some of the unique barriers, that is the culture, as you stated, Dr. D, of Muslim females feel more comfortable with females touching their bodies, etc. Even in communicating, sometimes they don't feel open in communicating to a man. And I was reading a study saying that if the husband is there, ask the patient, "Can I ask your husband?" and communicate through the husband. Just different barriers that are there. How do we continue to grow our understanding in our communities so that people will be more insightful how to navigate patients from different demographics, different religions, different faiths, etc.?
We do have something called CME hour for physicians, that they have to do certain hours every year or two to keep their certificate valid for the state. And maybe this is something that need to be done all over the country by mandating, like when I started in the 80s, we didn't have something called domestic violence. But now everybody knows about domestic violence now, because there is 1 hour requirement from Tallahassee Board of Medicine that you get every 2 years, every 4 years, domestic violence. And they did major things regarding narcotics and regarding death. We went through the 90s, 2000 in this country through a major problem with that. And they forced on us that we have to do this, especially in Florida. So I think this is something you need to come first from the activists in the Muslim community, the activists in the Afro-American community in Tallahassee, to say, "Listen, you're doing this for this physician. We need to do 1 CME hour on diversity and culture, and make sure that these doctors know what they're talking about, and take it from there." Dr. Malik.
I think training residents is what we can do as people of a Muslim faith or any other culture, minority. Having residents with us helps them get a new perspective from someone who's of that culture. And I think one of the big things I get in the hospital is I get a lot of Spanish-speaking patients or Creole-speaking patients. And I always, whenever I have my residents with them, I'm like, unless you pick up that interpreter line and get your history, I don't want that history of your broken English or whatever you're trying to get through with that patient with hand gestures. That's not a history, okay? And I try to stress the importance of understanding a patient in their language and communicating with them in that, telling them, hey, these are the medicines we're changing in their language, telling them these are the side effects you're going to have in their language. Okay, that makes a huge difference. I think training residents is a big way that we can do that. And I love doing it. You know, that part of the language, I can even say in my own experiences when my parents are trying to express to me something they're having, they say the word in Urdu, and I'm trying to translate it to figure out what is actually going on. And it's doesn't even make sense. I cannot make sense of what they're saying, even though I know the language. You know, so there isn't always a one-to-one translation of the word, so you can better understand what the patient is feeling.
Right.
But again, recognizing that that happens, maybe will make you open your differential diagnosis more. Okay, this isn't the typical dizziness. To them, dizziness means maybe they're lightheaded, or they're feeling weak. Like dizziness might just feel weak, mean weak in a different
Right.
language, you know?
Right. Right.
So there, I think that is something I always stress to my residents. And I love teaching my residents. I think they want all this knowledge. They want to know, and we have all these resources too in the hospital. We have this iPad that's on every floor. You just click the language you want and someone shows up, their face shows up, and they're interpreting for you right
Wow.
there. It wasn't that easy back in my day, I have to say. I'd have to, you know, go find the translator phone. I'd have to dial the number, wait for them to come on, wait for them to find someone. But now it's simple. It really was really cool to see that. And the resident showed me that, hey, now it's that easy. Like, okay, fantastic. Let's use this.
That's that funny, because I was going to ask you, did you have interpreters in the hospital? You know, and that's great to hear an advancement with using the technology we have.
Yeah.
I try to use that when I travel around the world. You know, I remember this goes back, my daughter was 2 years, about 3 years old, 4 years old, and the youngest was 6. And we had a deposition of Dr. Madame Brousseau in Paris. And I went to the deposition and took them with us. And somehow walking in Paris, my big toe got inflamed. And on every corner, there are these pharmacies. So I go to the pharmacies and I can't speak, you know, any French. And I'm trying to say, my toe hurt. I'm pointing at my toe. That day it didn't work. You know, my toe is getting more inflamed. So I go back to another one and I'm trying to point. I'm trying to say, you know, it hurts and it's not working. And finally, there was a person, American from New York, that had moved to Paris, and they interpreted. And the pharmacist said, oh, okay, gave me a little vial of some drops. I put it on there, and in like 3 hours, it was gone. But you didn't have, you know, the language apps on your phone. So it's good to hear that the hospitals are having language. Dr. D, you mentioned about continued medical education, if you will. We have some of that in the practice. We have a lot of that in the practice of law. We have to have 30 hours every 3 years total. We're running through a political challenge. I was the past president of the Florida Bar, first African-American president of the entire state of Florida. That was 14 when I was in office. The things that I did to bring the community together on inclusion, diversity, appreciating the richness of everybody's culture that we can all learn from. Today is challenged with our politic. You know, the Supreme Court got rid of the need for them to have bias training. Why would you get rid of bettering yourself to be aware that we have biases? Why get that out of their policies? You can't talk anymore and have programs on DEI. Those are bad words. Diversity, equity, inclusion. Our politics has taken such a drastic change. How is that impacting the medical practice, if at all?
You know, it does impact, but I really believe you know, like swing and pendulum goes right and left and right and left. But society go forward. If you look to history from 10 years to 10 years and 2020, I mean, here in South of Florida, I remember I lived at that time in West Kendall in Dade County, and my 2 kids went to small private school at that time, middle school. We're sitting in the graduation there, and the principal stood and he said, well, you really need to know that we have 115 children, middle school, from 52 countries. And I look around on the table. I have, Jordanian guy on left my side, Colombian guy, Cuban guy in front of me. So we're in South, either if we are political right or left, we are living in a big melting pot, as you said. So just, ignoring it, putting your hand in the sand and say doesn't exist, we don't care about it, it's not going to take you anywhere.
Right.
But for society has to go forward. We know we are a melting pot. We know we need to activate for ourselves. 20 years ago, there was no school day for Eid. We fast Ramadan, and after a whole month of Ramadan, we have like a Christmas for the Christian, or Passover for the Jews. And we fought for 10 years for the school to give the children a day off, and eventually we got it. And so yes, you have to fight and put whatever the spectrum, but we are here, we're not going anywhere, and we have to work together. That's the bottom.
Mm-hmm.
Dr. Malik?
Yeah, I agree. I mean, as long as we're all here, we maintain the diversity of this city, this town. I think we have a big say in which way things go.
I think the diversity of the community is one of our strengths. It really is. I mean, the cultures, if we accept them, understanding that, at core, we're all alike. When you get down to the 2 or 3 things, 5 things you want for your family, it's going to be 90% of what I want for my family, if not higher. But it's so much richness in accepting people that are different, as opposed to seeing them as outsiders. And I just think that we're going to have to continue fighting for those issues as you talked, Dr. D, about the pendulum. I get concerned because sometimes the pendulum takes a little longer than I want to come back to the center. But clearly history reveals that, you shift this way and you shift back. But one day I dream that we can hold firm to some principles of acceptance for all, in that middle, because some of the cultural fights that we have, I was looking at some Muslim young ladies, looked to be in their 18 to 20-ish years old, was at a mall, and some guy in a car was coming by and just insulting them about, go back to home where you are, where you're from. And these girls are not backing down, which I would have told them, don't engage in that. People are crazy. But they said, we are home. We were born here. And they, some of them were dressed in their what's the word for it? Yeah.
Hijab,
yeah. And others didn't have it on. But why pick those young ladies? Why do that? And he came into their center of faith and apologized that I was wrong. And I said, I don't know if you've really changed your heart that quickly. It was just public embarrassment that probably got him there, but he admitted he was wrong. So, in within you all's field, and particularly you, Dr. Malik, you've just gone through it over the last 10 years. Is there a good culture within the spaces that you go into, hospitals, within practice, within associations, of broad acceptance, even, across the board from all members, or is there some stress points within the practice of medicine due to the fact that you have a Muslim background?
I don't know if it's my naive view, but I can't say I've ever felt different because of my faith or my background. I feel included. I feel everyone respects my opinions and equivalent just as anyone else. I think from my side, things end up being a little bit different because different gender, that's a different thing. When some patients, they respect the input more of a male physician than a female physician, or an older physician rather than a younger physician, that to a younger female physician. So I think that's where perhaps I see more disparity rather than because of my faith.
That's a good point. Dr. D?
Yeah, it's I go back and progress cannot be stopped. And with the pendulum, you can have faster progress or slow progress. And I've been in this community for a long time. And when I initially came, uh, I've been a part of the board of a local community hospital for over 30 years. 30 years ago, we do have something called ACA. Dr. Malik knows this is like an organization that goes and audit hospital to make sure that they are really at all good terms and everything. So I was sitting there and the exit interview audit, the auditor, I will never forget that, he said, I want you just to look around and tell me what's wrong with the board here. I was young, I had no blue eyes, no blonde hair. So I just sank on my chair and I thought, I don't know what the guy is talking about. And nobody answered. And he said, well, all what I'm seeing around is white Anglo-Saxon males. And this is not what the board's supposed to be of a hospital. And you go forward 30 years, we have an amazing board right now, 40% female, 30% Afro-American, Hispanic, and everything. So these are happening despite, the pendulum go back and forth. And I think, as you said, we are in our community in South Florida, our strength is our diversity. I feel sorry when I go to other physicians in other community where they say, my God, I'm afraid with my wife who wear hijab, go to a social gathering when everybody look at us sideway and we feel uncomfortable and we don't know how to do that. So yes, could be a problem, but as Dr. Malik said, I've never felt in our hospital and that there is something wrong just because I'm from a Muslim background. Thanks, God.
And that's the strength and value of having people in the room from all walks of life. We get to know each other. We get to understand each other. I get called a lot about the judiciary, the bench, and I have been a big advocate over the decades of making sure the bench is reflective of the community. You don't have a right in the legal side to have a judge from your community, but it makes you feel good to know there's one in the courthouse. And people take notice of that. And there are areas of Florida that you don't have that diversity. I mean, we're unique down here. There's a big difference between South Florida and North Florida going on with the Pensacola Panhandle. I mean, it's just totally different demographics. And in y'all's inpatient experience, that somebody happens to be sick during Ramadan and that 30-day period where they're fasting from sun up to sundown, there's prayer, there's meditation, things they need to do in order to be faithful to their religion. Is there accommodations? Are there places where they can do that in inpatient facilities here in South Florida?
So as a patient, I mean, there are always, depending on what the patient's coming in for, they have physical restrictions of if they can get out of bed by themselves or if they need
Right.
assistance and all that. The hospitals do have like prayer rooms or meditation rooms where if you're not that sick, as a employee or as a worker there, you can easily go and pray in those areas. But as a patient, I can't say I know personally of anyone having asked like, hey, how can I go about praying here or anything. I can't comment on that.
Okay. That's fair. Dr. D?
Yeah, so that's a very good point you're bringing, and when the Muslim come and he knows this is like a non-Muslim hospital, and maybe they shy in and even don't ask. We know all hospital has a chapel and it's a place where you can practice the Christian religion. In our hospital, at least, we do have pastor for the Jewish religion and a pastor for the Christian religion. When you come into Muslim, it's probably different from a hospital to hospital when you need to call somebody from outside to facilitate this for the patient. It would be nice if this is something that all hospitals do, so patient knows when they come, the Muslim pastor go introduce themselves to the patient. Hey, we're here. Anything I can help you with? Then you open the conversation. Then you know what they need or they don't need.
Right. Good. Very good point. In doing some preparation for this podcast, I saw a statistic that caught me by surprise. It was talking about the religion, and Islam is, talking about the faith, with only about 20% of the Muslims being Arabs. In the United States, approximately 10% of the Muslims are Arabian descent, whereas the largest community of Muslims is Indonesia. And then the next point really caught me. In the United States, over half of the Muslims are African Americans. And I would have never guessed that big of a population, according to this study. And the first person I thought of was Kyrie Irving, the NBA basketball player, 2 years, I guess during COVID, that there was a big battle with him and his faith in getting vaccinated. And he literally missed half of the season, couldn't play the games because he insisted on not getting vaccinated due to his faith. And he could only go to those places that states allowed vaccinated people to participate. But that was a bigger percentage of population than I anticipated of African Americans converted to Islam. Let's end with, what are the 3 or 4 things that you all collectively believe, the messaging that you want the non-Muslim community and the Muslim community to do to enhance healthcare providing for that community?
I think for me, every time I try to educate patients is how to be a patient. I don't think people know how to be a patient. So by that, I mean, you go in with a notepad, you have your questions prepped. Like you said, you do a Google search, a ChatGPT search, say, hey, I have this, what question should I ask my doctor? Okay. I think that's the biggest thing you can have. Number 2 is have a family member on the phone. If you're an elderly person, you're hard of hearing, you don't speak the language, those are all situations in which you need to have someone on the phone who speaks the language, who can advocate for you, tell the doctor things that maybe you don't want to say yourself. That is very important. Again, and if language is an issue and you don't have a family member who can come with you, you ask for an interpreter line, knowing that resource is available. So maybe someone doesn't want to do it, but if you ask for it, then someone has to do it. And people can come to me at the end of the day because I'm a Muslim physician. They feel like perhaps I understand some intricacies better. And if they hear it from me that, hey, you're eating one too many rotis are like bread, maybe they feel like I understand their culture. So, okay, let me accept what she's saying, rather than someone who has no idea who's not of the same culture saying the same thing. Maybe they won't take it with the same weight, So if you can find a doctor of your culture, absolutely. But insurances are so restrictive. Not every doctor is contracted with every insurance. So considering that, I think going with a notepad, have a family member, communicate with anyone in your family who may be in the medical field, a physician, a nurse practitioner, a nurse, get ideas from them, what questions you need to ask, what resources are available.
All excellent points. Dr. D?
Yeah, I do agree 100% with Dr. Malik. Education and asking is important. Culturally, you feel you're inward, if you're not from the majority, although we have no majority in South Florida, but if you're not white is okay. If you're not Christian or Jews is okay, from Buddhi or Muslim, just be out and do not be shy and ask, because we all in the medical field respect our patient. We as a doctor want to help our patient. The question, the barrier, the language and the culture and the religion, and it's or for us as a physician and as a medical system to make it easier so we can connect better than the patient and for the patient to basically be open. And you ask about communities and what they can do. I think it is very important for us in South Florida, although we like our comfort zone, I want to only go to my segregation, to my church, or I want to go to my mosque, all my friends there. Having meeting or having social event between churches and mosque and synagogue, like they do at the upper level, I go and I attend, they do interfaith, and it's very good, very nice, talking about the pastor, the sheikh, and the rabbi stay together. But how about the base, getting interfaith and having social gathering and talking to each other? We miss that in our community, and that's something very important. If it can happen, then we'll live better life.
Yeah, I agree 1000%. And before I proceed to closing, when I was bar president, I noticed, there were various bar groups, the Muslim Bar Association, the Indian Bar Association, that they were not included. And they were brilliant people, so, really good lawyers at big firms, but traditionally they hadn't been brought into the association. And I made it my business to go and have receptions with every one of them. And when I say we're better when we stand as one, it's based on experience. When we come together, there's so much commonality in our humanity. But we get stuck so often on the few little differences that in the whole scheme of life are typically not very significant. But we let those few differences stop us from getting to know the whole person. And, I can't be more thankful to the two of you. You're coming from two different spectrums of experience. It sounds, Dr. D, like Dr. Malik coming in over the past 10 years. Sounds like some things are improving. And I'm hopeful 10 years from now, we'll see even more improvement. But I think we're going to really have to continue to have the conversations and help drive it. There are dynamics out there in our politics that cannot be allowed to change the course of what we're talking about. We have to be bigger than that and more committed than that, because every single person in this community and beyond has value within the family of humanity, and you all bringing your sensitivities to your patients is a starting point. So I commend you all for what you all are doing. When I asked Omar Chalet to give me a couple of names of some people that I could talk with, he said, I know a few people. And I'll have to tell him that you all represent the best of our community as a whole. And I wish you all well. Thank you so much for giving up your time. Hopefully somebody's been inspired from the candid conversations that you've had. And I take away that it's not a one-time discussion that's going to move the spectrum in the direction that it should be. We need to have these conversations, as you stated, Dr. D, with interfaith of different cultural groups more and more. And I know there are some groups that are trying to do that, and I'm fully available and engaged to have those conversations, because at the end of the day, we're all human beings and searching for happiness, good health, and family, some common values that we all share. So I thank you all for spending your time. I think you've inspired me, and I'm sure you've inspired the audience, and I really appreciate it.
The law firm of Halitzer, Pettis & Schwam is a proud sponsor of the Can We Talk 360 podcast. Our firm handles medical malpractice, wrongful death, and catastrophic personal injury litigation. We pride ourselves in being advocates for justice, on behalf of those who have been seriously injured. For decades, we've taken the lead in making your case our priority. It's who we are. It's who we'll always be. Halitzer, Pedersen, Schwamm. Serious injuries, proven results.
Thank you for listening to today's episode of Can We Talk 360. I sincerely hope that you were inspired to seize this moment in time and take real action towards change. Remember, all change begins with a conversation. Be sure to tune in every month for more fascinating discussions and motivational food for the soul. Please share with your friends, family, and colleagues. Follow me on Facebook, Instagram, and YouTube at Can We Talk 360, and visit us on the web at www.canwetalk360.com.